It builds on the current system, where most Americans get their health insurance from their employer. If you like your plan, you can keep your plan. If you like your doctor, you can keep your doctor. I can tell you, as the father of 2 young girls, I would not want any plan that interferes with the relationship between a family and their doctor. Essentially, my proposal would change 3 things about the current healthcare system. First, it would end the worst practices of insurance companies. No longer would they be able to deny your coverage because of a pre-existing condition. No longer would they be able to drop your coverage because you got sick. No longer would they be able to force you to pay unlimited amounts of money out of your own pocket. No longer would they be able to arbitrarily and massively raise premiums like Anthem Blue Cross recently tried to do in California. Up to 39% increases in 1 year in the individual market. Those practices would end. Second, my proposal would give uninsured individuals and small business owners the same kind of choice of private health insurance that members of Congress get for themselves. Because if it's good enough for members of Congress, it's good enough for the people who pay their salaries.
So it can be very confusing and overwhelming for people. So one of the benefits of Medicare Advantage is that it's one-stop shopping. The problem is, though, although the insurance company said that they could do it at a more efficient rate, it turns out that they can't. And so for the number of years, the government has been paying Medicare Advantage companies 14% more than what they pay under traditional Medicare. So it's a
So in other words,
huge
when the
expense.
government is your Medicare insurance company, the taxpayers are paying less than when a private company is your Medicare insurance company.
Right. And so so the government actually provides Medicare. The administrative costs are less than 5%, somewhere between 2 and 5%, whereas the Medicare Advantage companies, the administrative, profit, those costs are closer to 20%.
Well, Margaret, that's an interesting point you bring up, because this doesn't have to do just with seniors. As long as we've been debating health care since the Clintons first raised the reform banner, we've heard from one side of the debate that private industry can run healthcare better. They can do it cheaper. They're more efficient because the private sector is more efficient than government. Are we seeing the opposite?
We're actually seeing the opposite.
And why is that?
I think part of it is it's a lack of competition, ironically, because there are only a few insurance companies usually in each market, so there is a lack of competition. And there are certain protections that insurance companies benefit from, antitrust and those type of things. So, and they also have to take care of their shareholders first.
So in other words, they have to make a profit, so that gets built in.
Right, because a lot of seniors can't afford to pay for those drugs, so they don't, once they get to the donut hole, they either stop taking their drugs or try to conserve them. And if you've got chronic conditions like congestive heart failure, diabetes, hypertension, you can't stop those drugs without, tremendous, damage to your health. So the one benefit of the new law would be the additional prescription drug benefits. Another thing is that preventive care is added. Right now, a lot of people don't realize that you can't go to the doctor for a checkup. That's not covered by Medicare.
Wait, if you're on Medicare, you can't get an annual checkup?
No.
Seriously?
You get one. There's a new, in the last couple of years, they've added welcome to Medicare visit. So you get when you turn 65, you get a welcome to Medicare, but that's your only preventive
You're 73, you can't go to the
healthcare.
doctor unless you're wretched or something?
Unless you're going to pay for it yourself. So preventative care is added in the new law, and you get to have an annual visit with your doctor, and you also, there's no copays for this preventative care. So that's another big benefit.
My name is Tiffany Stewart, and my question, as a recent college graduate, I want to know what options are available to people who just graduated college who are no longer covered by their parents' insurance and who may be seeking a job right now or whose job may not offer insurance.
So what's going to happen to the people who are 22 years old and can't get insurance on their own?
Well, and what happens right now is those people just don't get insurance. They tend to be the healthiest among us. They don't get insurance coverage, and so they risk it, quote unquote. Under this plan, there will be coverage through age 26, I believe, for individuals who have graduated and can be covered under their parents' insurance. Your option right now would be that you could go and find buy independent insurance. The unfortunate side of that is that insurance, because you're a young woman, is going to cost you more money than it costs your male counterpart. And you know, in the long run, you may not even be able to get insurance at certain insurance companies because you're a woman of childbearing age, and there are some parameters around that. So you know, this kind of plan that we're talking about on Super Bowl Sunday that could get passed will significantly help people who are caught, young people who are caught right now without insurance, because they can stay on their parents' insurance for 3, 4, 5 more years after they graduate.
So in other words,
from
Aetna
college.
can't tell Tiffany, too bad, you're too old now, you can't be on mom's insurance plan.
They wouldn't be able to do that.
One World is committed to keeping the community informed about healthcare issues. The first aspects of President Obama's healthcare reform program went into effect on September 1st. You can learn more about these key aspects by visiting the web address on the screen.